A 23-year-old man, he had been on doxycycline therapy for a chlamydial infection. He is only having single partner, but now once more he developed dysuria and he is found to be chlamydia positive. So what is the most likely reason for this? There is a phenomenon of reinfection in chlamydia. So he infected his single dedicated sexual partner, and though he took the doxycycline, got relieved, once more participating with his partner led to development of reinfection coming from the partner is a typical clinical scenario in this given case of chlamydia trachomatis infection. A 60-year-old man is having shortness of breath and is found to have FEV1 of 70%, obstructive lung disease. But he stopped smoking and 5 years passed. What will happen to FEV1? FEV1 improves. That's a good news to the patients in early phase of the COPD. The FEV1 will become the same like any other non-smoker of the same age group. So that is what you should remember. A 4-year-old girl is brought to the physician. She is having a blood pressure of 90/60. SN2 is normal. There is only a grade 2/6 systolic vibratory ejection murmur in the fourth intercostal space. So this question is calling you whether you have knowledge about innocent murmurs and true organic murmurs. So typically the 7 yes you need to remember in case of innocent murmurs. Innocent murmurs, yes for sensitive. What is the meaning of sensitive? They change with the position of the child and with respiration. Yes is a short duration. They are never holosystolic. If it is a holosystolic murmur, more likely to be organic. They are short duration. They are single. That is, they are not married. They don't have clicks or gallops. They are small. Typically, they are non-radiating and limited only to one small area. They are soft. That is, they are low amplitude. They are sweet because they are not harsh sounding. They are systolic. They are only limited to systolic. If a murmur is diastolic, you should worry whether it can be organic murmur. But systolic murmurs can be organic, can be innocent, and you should know what are the 7 yes you should remember when it comes to a systolic murmur. A 25-year-old NEET PG exam aspirant, she had a 10-year-old history of asthma. She is having a lot of stress last 3 months for the NEET PG preparation. Honestly, there is no stress needed. If you are preparing logically, there are just a list of 600 topics. Out of the 600 topics, if you are a very bad student in the entire MBBS, 100 topics only you will be good. 500 you need to become good. You are at level 2 or level 1. You need to come to level 5. So as you keep quickly brushing those topics, from 100 topics you became 200 to 300, 300 to 400 topics you became level 5. Then any entrance, any damn entrance in the world that you take, you will clear. The whole problem where we get messed up is we attend a live coaching, we attend a face-to-face coaching, we attend online coaching, but we are not remembering that what are those 600 topics? Which topics are my 100 naturally good topics? What are those 500 extra topics where I need to improve? What are the topics where I am level 2? What are the topics where I am level 3? Somebody should do the diagnostic test on you. You should run through the diagnostic process. Then you know what you are already good with, what you need to improve, and whether you have improved or not after preparing. So how can we be able to know that? How can we be able to know that? We can only know that. Download the UMedico. Next week we are coming up with the artificial intelligence engine which will give you the list of 600 topics. You run through a 10 question diagnostic test on all the 600 topics. You can compete with somebody else, or you can do it solo, or you can pick up a random player and can be able to play 10 second per question, 10 questions, 100 seconds. Every 100 seconds, there is a report created. This test, what is your, this topic, what is your level? This topic, what is your level? How your other friends on the Facebook who also downloaded UMedico, what is their level? And you can invite one of those friends, come on, let's play on the topic of hyperparathyroidism. Let us see how good is my level. I already read the topic. You can invite the friends, they get a push notification, and you can play. And playfully, khelte, you can be able to finish the revision. And all 600 topics, you should come to level 5. Then if you don't get the seat, I resign from teaching. So the role of the teacher is not to keep on feeding you with facts. Google has enough facts. You don't need to learn from a teacher in the modern times. But what is the need of the teacher is like in Kung Fu Panda, the role of the teacher of a Kung Fu Panda. The modern teachers, we are all the Kung Fu Panda's teacher. You are the Kung Fu Panda. You need to know where I'm good, where I'm not good, where I'm having some complete fear on certain topics, where I need to brush up myself. So that if you know and you come to a confident level in all the 600 topics, any entrance you go, you can be able to win. So there is a whole idea of the new version of the UMedico. I request all of you to download. Next week it is getting released. So doctor, this patient who had that stress of the exam, now she is having V's. Recently she had migraine. So what's the most likely possibility for the worsening of her V's among these drugs? It is the propranolol, the beta blocker,